What's good, you guys? PCOD is a very common female endocrine disorder which affects every 1 in 5 women all around the world. In today's episode, Dr. Veena Aurangabadwala, who is a consultant gynecologist obstetrician from Zen Multi Speciality Hospital, will help us understand how this disease affects so many women around the world and how to treat it and what are the cures. Let's dive in. So, welcome, ma'am, to Playground Podcast. To start with, Veena, ma'am.
Yeah.
We had a small survey in our own classroom itself. So, and we asked them about female menstrual questions and PCOD and PCOS. So, out of them, 60% are aware about what is it, and 35%, 40% of them are not aware of it. Okay. So to start off with the question, the very question which came up to my mind. So before getting into the questions, I must say this: I am not qualified enough to talk female-related problems, but I'm very eager to know about it and get educated about it.
Right.
That is the very first thing.
Right.
So to start on with, if you can explain about what's a menstruation cycle and how does it go?
Okay. See, basically, the menstrual cycle is at the bottom line, leaving all the external appearances. That is what exactly differentiates you from a female genotype and a male genotype, right? In terms of humans. So what exactly happens during a menstrual cycle is, unlike the males, where the gonadal development in the males is totally different. In females, it starts with what is called as a Mullerian system, that is a female reproductive system. This Mullerian system basically confirms or goes forward, and it includes the uterus and the fallopian tubes, and part of the vagina as well is formed by the Mullerian system. The gonads, that is the ovaries or the testis, they basically determine whether you develop the Mullerian system or you develop the Wolffian system, which is the male system. So once you have an ovary in place and you have a right Mullerian system in place, you start having your menstrual cycle, or you get what a female menstrual system you would get. So what happens in a menstrual cycle is there are certain hormones which stimulate the ovaries to actually grow follicles and give rise to a mature ovarian follicle, which later at the time of ovulation gets released from the ovaries, so that it forms the ovum or the egg, which is then fertilized by the sperm, which travels all the way up from the vagina through the uterus into the fallopian tubes to reach the egg, to fertilize it, to form an embryo. And that embryo is then slowly returned back into the uterus, where a new life or the implantation occurs, and there is a generation of a new life or a fetus that starts off, called in medical terms. So what happens during menstrual cycle otherwise is, like I told you, the egg reaches the fallopian tube, but because there is no sperm which has reached the fallopian tube well, the egg gradually, after a period of 48 hours, gets dissolved, meaning that it sheds off. So while the egg transfers itself, grows from a mature small follicle to a bigger Graafian follicle and then ruptures as an egg, the uterus in return every month prepares for a possible pregnancy. So the uterus then grows similarly in lining, and its inner wall grows like, basically it's like a crop getting ready. So it gets ready like a basal endometrium and forms a good base for, if at all the crop is going to form, then it's getting the crop ready. But unfortunately, if the egg doesn't get fertilized and the egg dissolves, then what happens is that the hormone levels in the ovaries go down. Instead of the progesterone increasing exponentially, the hormone levels start dropping. So now the inner crop or the inner lining of the uterus, which has grown to receive a pregnancy, doesn't receive the stimulus from the hormones that one has conceived. So then that inner hormone lining just gets shed off. It just withers away. And that withering away is what actually women get as a menstrual cycle. So if I have to tell it in terms of timeline, it is as a menstrual right from the day one of the menstrual cycle, on an average, the follicle slowly keeps on growing to reach the stage of ovulation somewhere between the 12th to 14th day of the cycle. And then once by 16th or 17th day, if there is no fertilization of that egg that has occurred, then the withering phase started. So that 14 days post the egg release, there will be a menses or the fresh menstrual bleeding will start, which can vary in women from say 2 to 3 days to as much as 7 to 8 days. So that's how a normal menstrual cycle would go. So there are certain hormones which interplay with them. The most important two hormones are produced by the hypothalamus in the brain, which are called as the follicular stimulating hormone. In short, it is identified as FSH. And there is a luteal hormone or a luteinizing hormone, which is the LH. Now, these two are the main hormones which come from the brain, which help this cycle of egg growth, reaching the stage of ovulation, and then the egg not fertilizing, and then the menstrual lining getting shed off. So different levels. So in the first half of the menstrual cycle, till ovulation takes place, the FSH has to rise. And very low levels of LH are there, just baseline levels. But then once the ovulation, just before ovulation, the brain secretes what is called as an LH. This LH surge, so sudden, like a bout of LH hormone, causes the ovulation to take place. And then because after ovulation, the LH bounce is there, but after that, the progesterone hormone is secreted by a cyst in the ovary called corpus luteal cyst. But if there is no fertilization, the corpus luteal cyst also dissolves and gets punctured and gradually reaches a stage called corpus albicans, which is white, that is albinism, right? So it becomes albicans and it constricts. So there is no progesterone then. So this drop in progesterone level then causes the menstrual cycle or the menstruation to happen 14 days after the ovulation has occurred. So, and this usually is the pattern followed in most girls, but as you know, there are physiological variations. So depending upon differences in cycle, and like I said, the ovulation can happen as early as 9th to 10th day. Sometimes it can happen as late as 17th day also. So on an average, any girl's normal menstrual cycle could be ranging from between every 21 days to every 35 days. So both are normal, from 21 days right to 35 days. Yeah.
Okay. That's a very elaborate explanation, and I'm sure
it was not too overboard.
Yeah, that went a little bit bouncer, but yeah, I'm trying to understand because in my mind it started with pituitary gland and the luteinizing hormones, which gives a surge to the hormones.
Right.
So yeah, and if I talk about the hormonal imbalance and we come to transition into PCOD, how does that happen? How is it making the female body difficult to, you know?
Okay, so like you rightly said, that now we know exactly what is the normal. So now we can understand what is abnormal better. So what happens in PCOD, or whenever there is a change in this shift where the FSH, which is supposed to be higher in the first half of the cycle, and the LH higher in the second half of the cycle, if that doesn't happen and there is a constant high level of estrogen, and which in turn also, like you said, from the pituitary gland also keeps getting a feedback that there is high estrogen. So it keeps on producing high levels of LH also. So the luteinizing hormone, which is actually partly an androgenic hormone also. So the luteinizing hormone remains high even in the first half of the menstrual cycle. And this problem of the estrogen remaining high and the luteinizing hormone remaining high doesn't allow ovulation to take place. What happens is that the eggs do not reach the stage itself where they become big enough that a mature follicle can form and get ruptured from the ovary. What in turn happens is that there is low level of FSH compared to the LH, and there are a lot of small follicles in the ovary maturing at the same time, but no follicle matures fully or completely. As a result, there are immature staged follicles which start growing halfway, but none of the follicles reach the stage where they really have to expand and get to the stage where they would actually break open from the ovary and get ovulated. So as a result of this, there is no the progesterone surge again, it does not happen. And therefore, since there is no ovulation or barely any ovulation, that is, out of 8 cycles, maybe the lady will ovulate in 3 or 4 and will not ovulate in the remaining 4. So that is why, which is called as oligo ovulation. So because there is either oligo ovulation or anovulation, then the menstrual cycle, which is supposed to follow 14 days post, doesn't happen. In turn, the girl misses her period, and then gradually she may either miss one period and get her next period, or sometimes it does happen that the inner lining of the uterus has grown so much that she does get her menstrual cycle, but very scanty flow. So this what is a cyclic process which keeps happening. And that is the reason why the ultrasound picture of the ovaries starts showing to be polycystic. And that's where the name polycystic ovarian disease comes from,
Okay.
where the ovary starts looking as though it has got multiple cysts in it, which are actually multiple follicles which are in their immature stages. So that's how PCOD starts off.
Okay.
Yeah.
So,
and there are multiple triggering factors to it, which we will discuss in further.
Yeah, sure. So, what are the physical and mental effects which a woman has to face when she's having PCOD?
Right. So, as per if see, just a picture of polycystic ovaries on sonography does not label a girl to have polycystic ovarian disease. It has to be a symptom complex which has got some clinical signs as well. For example, like I said, if there's a girl who is not having regular menses, is having missed periods or having very irregular menstrual cycles, sometimes not having periods for 2 to 3 months. Second, sudden weight gain, okay, which is not exponentially. There is slight sudden increase in the weight beyond the control of the girl. Third could be a development of androgenic features such as acne, excessive hair growth over the face and the chin, and kind of which is called as hirsutism. Excessive hair loss from the scalp, which is thinning of hair and scalp hair loss. So these are some of the clinical signs that the girl faces physically. She can also start having blackening or excessive pigmentation at the nape of the neck at the back, especially, as well as in the front, which are called as acanthosis nigricans, which is a sign of insulin resistance in the body. Okay, so these are some of the physical features that a girl would see. The mental features could include lack of self-confidence, feeling of depression, feeling drowsy most of the times in the day, having some sleep disturbances, and also feeling very lethargic. There is poor concentration. So these girls are not able, they themselves notice that, my concentration is not being the 100% that I could give earlier. So these are some of the mental or the clinical mental effects that a girl in PCOD would experience.
Okay. And you mentioned about insulin. So my understanding about whole insulin is when we intake carbohydrates,
Right.
it is broken down into energy, and it further secretes into broken down into insulin.
Right.
Okay. So how does the whole insulin cycle affects the weight control or the imbalance in hormones?
Right. So what a slight change in that breaking down is that most of the foods that we eat, especially the Indian diets, they get broken down into carbohydrates. Now these complex carbohydrates then get further broken down into glucose. Now insulin is a hormone which is produced by the beta cells in the islet of Langerhans in the pancreas. Okay, this is a hormone which regulates your glucose cycle or a carbohydrate cycle. So insulin is a hormone which converts the glucose and utilizes it for energy. At the same time, whenever there is excess glucose in the body, it converts this glucose into glycogen, it converts this glucose into protein, and it also converts part of this glucose into fat cells or fats. Okay, so whenever normal procedure would be that the glucose is converted by insulin, utilized for energy. Glucose and these insulin also not only plays a role in breaking down glucose and converting it into others, but insulin also plays a role in the ovulation part that happens, because there are insulin receptors even on the ovaries. But what happens in cases of insulin resistance is that there are receptors on the ovaries, but these receptors have got resistant to the action of insulin. As a result, the insulin is not able to act on the ovaries, so ovulation does not take place. Also, at the same time, when there is insulin resistance and the insulin receptors, although there is enough insulin, but that insulin is not able to break down the glucose. As a result, the body and the pancreatic cells keeps producing more and more insulin. Okay, but the glucose is not getting acted upon by the insulin. So the glucose, instead of getting broken down and used for energy, gets converted into fats. And that ends up making the woman put on more and more weight because the glucose is not getting utilized for energy. She feels tired and drowsy and, lack of energy, although she's been having carbs and she has an excess of carbs in her body. But because there is insulin resistance and the glucose is not getting utilized, she feels tired all the time. And because this glucose gets broken down to fat, she keeps putting on weight. And part of the glucose which is supposed to be broken down by insulin to protein, which are the bodybuilding, proteins are the bodybuilders and the muscle builders. So there is a lot of weakness and muscle wasting that happens in this case. So that is why insulin resistance is one of the key findings that we have found in cases of polycystic ovarian disease. And by understanding this logic, insulin resistance and insulin sensitizers have been used to treat the polycystic ovary disease in wholesome.
The last one which you said, the insulin, which is insulins,
insulin sensitizers.
Sensitizers. So can you elaborate on that? What is that exactly?
Sensitizers are certain drugs which act on the insulin receptors, and because these receptors have become resistant to the action of insulin molecule per se, they block these insulin receptors which have been damaged. Okay, and they sensitize these receptors, meaning they make them again receptive to the action of insulin. So there are certain chemicals, for example, metformin, which is an insulin sensitizer. Okay, another is called glyburide, which is also an insulin sensitizer. Now, these drugs are also used in the management of diabetes. Okay, type 2 diabetes, because in type 2 diabetes, also the main problem for the glucose levels being high in the body and hyperglycemia being detected is insulin resistance. So although they are used there for the action of correction of the glucose levels, in the cases of PCOD, because they make the ovarian receptors which have become resistant, they make them sensitive to the action of insulin. So insulin helps the egg release to happen. And then because the egg release happens and ovulation does occur, the cycle of PCOD gets broken and the girl starts menstruating again. And so the accumulation of these small follicles into the ovary, immature ovary, gets stopped.
That's very deep, I must say. So since we're talking about PCOD, it's seen that I've done a little bit research also, and it's seen that 1 out of 5 girls have PCOD. So what is the main reason for this? What is the history of whole PCOD?
Right. See, the reason why you must have noticed that compared to the last decade, this decade is seeing a lot more PCOD. And it has been on the rise in the last 2 decades. The reason why I'm saying the last 2 decades is because right now I'm around almost reaching my 40s. And around the time when I was an adolescent, I also faced the problem of PCOD. Okay, which is obviously about 20 years down the line. But what I mean to say is that, see, earlier, every single PCOD does not require treatment. And at the same time, earlier, the incidence of PCOD was not that much. The reason why there is an increase or rise in PCOD is because point number one is that women are attaining menarche at a very young age nowadays, where the initiation of menstrual cycle earlier used to be around between 11 or 12, 13 onwards till the age of 18. Now, menarche, or the starting of menstrual cycle itself, happens in as young girls as 9 years of age, which is because of lifestyle changes. For example, very high fatty foods. We have 20 years back, malnutrition was a problem in our country, but now overnutrition is a problem in our country. It's not malnutrition, but overnutrition and obesity. So if you take on an average about a class of 20 years back, of maybe first standard or second standard children, you would find that majority of the girls were extremely kechexic, they were thin and they were malnourished. But now if you see girls around, in their second or third standard or fourth standard, majority of them are extremely overweight. So there is a lot of physical weight gain that they have had. there's not that much of physical exercise that our younger girls are doing because of a lot of utilization of gadgets. So as a result of gadgets and more screen time, they're actually, going from physical play to more of mental play and, indoor games and sitting activities. So this main lifestyle change has caused a problem in the overall physiology of the body. Meaning that, so we eat a lot because we are kids and we are hungry, and we also eat a lot of chocolates and cakes, and these are all empty calories because they generate the carbs in these get rapidly broken down to glucose because they are like high caloric foods. What do you mean by that is that equally the carbohydrates get broken down into glucose really quickly. But if there is, that remains normal as long as the child is physically very active. So they burn out their calories, they burn out their energy. But if you're not being physically active and not being very upbeat, then all these extra calories that you're eating are getting converted to fat. You're gaining a lot of weight. And as a result of this, the incidence of PCOD has started going up tremendously right from adolescence. So many times it gets detected, many a times it just gets overshadowed because majority of parents also and the girls themselves keep thinking that no, this is probably just a phase because my menses have just started. The first 2 to 3 years post the initial menarche are supposed to be irregular cycles. Yes, they're supposed to be irregular cycles because the pituitary, hypothalamo pituitary ovarian axis is not fully developed. But when this extra weight gain and obesity element and the high BMI gets added to this with lack of physical activity and a lot of mental stress, pardon me, because the mental stress is now quite high, competing with online exams, competing with trying to do 10 classes, and they are running from a grammar class to some maths class, or running to a what do you call it, phonics class. I've heard of phonics class right from first junior KG, senior KG. So there are a lot of classes. So there's a lot of mental stress happening, and you're not balancing your physical stress with it. So when there is a major imbalance in the physical and mental stresses that a body is going through wholesome, that's the reason why PCOD has gone up tremendously in the last 10 years. And more so now because of the COVID pandemic in the past 2.5 years, because most everybody is stuck indoors. The classes, school is also indoors, it is online, it's only screen time, or much ever some of the schools are putting in efforts that, they give some physical activity by, having a sports class or having a yoga class, in between their school periods. It's still not equivalent to overt outplay, the ground play or all that. So physical activity going down, and plus the stress now that COVID has created, it has tremendously increased the incidence of PCOD, I can say, in the last 2.5 years.
Okay. Yeah. So talking about mental stress.
Yeah.
So if I talk about both the genders.
Yeah.
So mental stress are very much equal to both of them.
Right.
Okay. So is there any difference in handling stress between both the genders, or is it the same? Is there a difference in capabilities of handling stress? Because it's a very concerned issue nowadays.
Right.
Okay, and you are telling that mental stress is directly connected to PCOD as well. So I'm stretching on this topic.
Right. See, mental stresses are equivalent to both genders. It's just that you must have heard of the fact that mental maturity comes earlier in girls compared to males.
Yeah.
Basically, the pubertal age in girls is much higher. If you see the development part is that there are growth spurts. Okay, so in girls there's one growth spurt, whereas in cases of boys there are two growth spurts. There is one growth spurt which happens very early in childhood, like around the first, second standard and third standard, and then there is another growth spurt which happens around the 8th, 9th, 10th, where boys suddenly grow from like 4 feet 5 inch to like sudden 6 feet, So there are two different growth spurts, and that is the time where that is the main thing that differentiates girls from boys. In girls, that second spurt doesn't come. That second growth spurt suddenly doesn't come. So there is a constant growth that happens once the menstruation starts. Usually till menstruation or just before menstruation, there's a spurt. And then after that, once the menstrual cycle starts, there is no further growth spurt, because this estrogen hormone or progesterone hormone, once they start the cycle, they tend to ossify the bones, So the bone growth gets fixed, and the ossification centers get completely ossified. So the height growth and the length growth and all becomes more stagnant. So that is, but once that becomes stagnant, their mental growth starts happening much faster. So they start processing a lot of information, and that's why you must have, you must have experienced that if there are two siblings, one being a boy and one being a girl of the same age group, the girl tends to have a higher level of mental maturity than the boy. Okay, so when there is a higher level of mental maturity and faster maturity, and during this time, because all this happens in the brain, and the pituitary gland is also situated in the brain. So when the pituitary gland hormones which are playing in the pituitary gland, for example, the prolactin, the thyroid stimulating hormone, the FSH, LH, so these also hormone levels, when these hormones levels are affected, in turn the mental system it also starts shaking. So that is the reason why I concentrated on the fact of stress. Because when there is a lot of stress, this pituitary gland also starts undergoing irregularities in the hormone secretions and can give rise to PCOD. Because the main problem starts from there, not from the ovaries per se.
Yeah, correct.
Yeah.
So I'm sure many of the people hearing this might go to Google and just type PCOD and start searching about it. Yes. So even when I did it, I got two different things. One is PCOD and one is PCOS. So is there any difference between both of them?
Right. So PCOD, there is definitely a difference between PCOD and PCOS. So what happens in PCOD, it is more commonly, PCOD is a more common disorder than a PCOS. You must have obviously learned the full form also, that PCOD stands for polycystic ovarian disease, whereas PCOS stands for polycystic ovarian syndrome. So while polycystic ovarian disease is limited to one organ, which is affection of the ovary and affection of the menstrual cycle, because it is affecting the ovary only. What happens in PCOS is that it is a syndrome of symptoms. So it affects multiple organs. So not only does here it causes problems in ovulation, but the hormone imbalance that is caused here and the anovulation that has caused here in PCOS then starts affecting the other organs also. For example, it also starts giving rise to affection of fertility. Then it is more of a metabolic disorder where again the glucose control gets affected. So you start having obesity as one part of it. Second is because there is excess glucose getting converted to fat. So there is hyperlipidemia and dyslipidemia. Okay, so fat metabolism is affected. You have obesity on your hands. You also have androgenic excess. So you have excess of male pattern hormones that are coming out. So the androgen levels get affected. So all these together make a complex syndrome called as PCOS. And these women who are having PCOS, who start having dyslipidemia, start having obesity, are highly prone to develop gestational diabetes in the next 10 to 20 years. Okay, so as a result, this finally PCOS goes to a condition called as metabolic syndrome, where it affects the metabolism of all the three major components, the protein, the fat, and the carbohydrate cycle. And that is not only dangerous to life in future, because it obviously in the long run will affect the heart and the cardiac health as well. So because of dyslipidemia, you must have heard of HDL cholesterol and LDL cholesterol, the good cholesterol and the bad cholesterol. So this dyslipidemia starts affecting the good cholesterol, bad cholesterol levels. Bad cholesterol increases, increasing the risk of heart attacks and myocardial infarction. On the other hand, because the glucose levels start going up, diabetes, diabetes has a lot of complications on a lot of other organs. It'll affect the kidneys, it'll affect the retina, causing vision disturbances. It'll affect the kidneys, causing kidney disease, chronic kidney disease, and at the same time also increase the incidence of endometrial and ovarian cancers. So that is why PCOS is a much more serious condition, unlike PCOD, which is much more common and a slightly easier condition to correct. So before PCOD reaches the stage of PCOS is where we have to stop it and correct it. So if I give you an average, PCOD will affect 10% of girls. PCOS would have affected about 0.5 to 2.5%. So the incidence of PCOS is less if we start attending it at the stage of PCOD and prevent it from going to PCOS.
So as complicated as the whole PCOD and PCOS, I'm sure they
make my answer short so that it doesn't confuse you.
Yeah, I know. Yeah. So as I was saying, as complicated it is, I'm sure there might be a lot of myths about this.
Right.
Okay. So one of them, which I find was which people are searching more is, if we lose weight, can we get rid of PCOD? Is that the case? Or
See, if you lose weight, it's not necessary that you can get rid of PCOD, because it is not only obese girls or those who put on weight who get PCOD, but there is something known as lean PCOS also, where girls are very thin. They are extremely thin and they still have PCOD.
okay.
Yeah, so PCOD is not only for for those who put on weight are only PCOD. So let me make it a little clearer. Sudden gain in weight, at the same time sudden acute loss of weight, both can lead to PCOD, because both will affect your menstrual cycle. Both cases, the pituitary gland undergoes changes in the FSH-LH hormone, and so you could have PCOD if you suddenly do a crash diet. For example, some people want to kind of follow sudden crash diet, and I want to go from 50 to like 30, or for some random reasons. But the sudden weight loss could also lead to what is called as lean PCOD. So I have a lot of patients in my clinic who are extremely lean but still have PCOD. So here now comes the line. So if you lose weight, it is not necessary that you will correct PCOD. So only dieting is not the treatment of PCOD. So you have to actually just be healthy to actually become PCOD. So there can be a girl who is 90 kgs, but she is tall, her height is good, and she actually falls into the normal BMI range or slightly overweight BMI range. But this is a woman who's been exercising, who's eating the right foods, who's genetically been on a higher weight scale because of her genetic composition of her parents, but she doesn't have PCOD. At the same time, a girl who's just 55, 60 has PCOD. Okay, so what you have to do is not lose weight to gain PCOD, but eat right, eat healthy, eat right, and at the same time do amount of physical exercise equivalent to your diet, so that you can avoid or prevent PCOD from coming. But let me just correct myself again.
Yeah, sure.
Adding a small point. Yes, those who have obesity or who were earlier thin and have suddenly now put on weight and have started having menstrual irregularities and PCOD symptoms will benefit by losing weight, but in the right way. Through a right, they need to be actually guided on how to lose weight by a dietitian or by a physiotherapist or an exercise specialist, so that they can guide correctly, so that they don't suddenly crash diet and lose weight, because then they'll still have PCOD.
And when it comes to pregnancy, what are the effects on that?
So if you have mild PCOD, you may not have any problems in getting pregnant. Okay, but PCOD, only a PCOD picture on ultrasound, like I said, polycystic ovarian picture seen on ultrasound can be just a temporary finding. Okay, and if at all your hormone levels are normal and you're not having any clinical symptoms of PCOD like anovulation or hormone excess, androgen excess, right, acne or hirsutism, you may not have any problems in conceiving. You may just have slightly longer menstrual cycles. Instead of a proper 28-day cycle, you may have 35-day cycle. And these girls find it very easy to conceive. On the other hand, only if you have symptoms which have metabolic disorders already starting, for example, like PCOS, where your glucose levels are haywire, your prolactin levels have also gone slightly haywire, and your when we do your androgen hormones, for example, DHEAS or 17-hydroxyprogesterone, and those hormone levels are also found to be haywire, then yes, these girls or women will find it difficult to conceive and to get pregnant. So then, because ovulation is not happening, and without ovulation happening, how will they get pregnant? So first thing is to start helping them ovulate, for which we do use insulin sensitizer so that their ovulation can come back on track. And also give them medications which will help in inducing ovulation, and they are called ovulation inducing medications.
So, and about irregular menstruation, as we are talking about,
yes,
does it occur to every woman?
So every woman who has PCOS will have irregular menstruation. Every woman who has PCOD may not have irregular menstruation. So you could have regular menstrual cycles and have no other, proper menstrual cycles, and maybe slightly scantier flow. But if you are having anovulatory cycles, so the ovulation is not happening. But every girl who has PCOD need not have irregular menstruation. because there is something called as the Rotterdam criteria. So for calling a girl PCOD, these three criteria have to be met. One is, like I told you, oligo-ovulation or anovulation, which means either menses are scanty or they're not coming at all, the androgenic features, and sign of PCOD on ultrasound. So a woman may have the latter two symptoms, having androgynous features of acne and hirsutism and having ultrasound picture of PCOD, but she doesn't have menstrual problems. So she's still labeled as PCOD. Okay. So every girl of PCOD need not have irregular menstruation. But so that is why if a girl starts having normal periods, but at the same time has an eruption of a lot of acne coming up, a lot of hirsutism, excess hair growth over the face, meaning, the easiest way to undergo is I'm doing my upper lip much more frequently than I used to do it about 6 months earlier. I'm having to go every 15 days for excess growth on my face. So that is one. So that could be a simple clinical indicator, sudden eruption of a lot of acne happening, and the fact that, I'm gaining weight. So that could just be the symptom of PCOD, and they should actually consult a doctor or a gynecologist to know whether they are having the other subtle signs of PCOD without their menses actually showing the signs.
Since you're talking about all the problems, I would like to come down to these solutions as well.
Yes.
Like is there any precaution to be taken, or if a girl is suffering from PCOD, is there any cure for this, or a permanent cure for this?
Right. So the best is always, they say prevention is better than cure. That's why, prevention is the bottom line. Prevention is much easier. So since we now know that PCOD, and we've discussed that, that diet and physical exercise plays a very important role in preventing PCOD. And I also added that stress is a very important factor which can trigger the onset of PCOD. Okay, and that is one of the reasons why adolescent girls who are actually in their 9th or 10th, standard, or in their 11th or 12th standard, is the time when they actually start having PCOD. Because that is the time when they have a lot of stress of board exams, a lot of stress about their entrance exams and what is going to happen in the future. And these stresses, in addition to the family pressure that comes in, they also put in a lot of peer pressure on themselves. So because of this, the PCOD starts. So to prevent PCOD, all these three have to be prevented. Eat the right foods, okay? Have a balanced diet. Yes, we all love junk foods and we all love a little bit of pizza and pasta and all that, but that cannot be made a very frequent occurrence, because the body has a certain, you can say like a certain cutoff. So, it can tolerate a certain amount of insult, but it cannot tolerate an insult beyond that. So food is very important, where they should stick to a proper diet pattern where only 40% of the diet is carbs. A major chunk of 50% of the diet should be protein, a 20% of diet being fat, and the remaining amount has to be a lot of water. So fluid intake is very, very important. So have adequate amount of fluids, because majority of Bombayites especially, I don't know whether others, but the fluid intake or water intake is very little. While you're in college and school days and all, you don't feel thirsty, you forget about water. So important fluid intake, high protein diet, eating on time, not skipping breakfast, because you start a day in the morning and you sleep at night. So we are not diurnal creatures, we are like morning creatures. So we have to have a wholesome breakfast. We can have a lighter lunch and an even lighter dinner, because we're going to anyway sleep at night. Second is to not go off to sleep immediately after eating foods, because then you are not giving enough time for your food to get digested. Okay, and that's where this glucose metabolism again goes a little haywire. If you suddenly go to crash bed, especially immediately after eating. So that is another thing. Physical exercise. So physical exercise could be of any form. It need not be like going to the gym itself, or or actually going only for like a weight training or something. It's just physical exercise initially. So it could be playing any form of sport. If somebody is interested in dance, then dance is an excellent form of exercise. Okay, but you just have to be regular at it. That's all. It doesn't mean that you do dance one day and then 2 mahine ke baad some kind of a rehearsal practice, but some physical exercise which has to be there at least 3 to 4 times a week, at least 1 hour per time. So it could be yoga, Zumba, dancing, aerobics, any sport. If you're playing badminton or squash or some kind of a physical sport, I don't mean carom board by that, or chess. Okay, so these are some things which are. And the fourth is to not take too much stress, because these exams are not the end of life situation. They are not career changing situations. Yes, we've all gone through it, but not take too much tension about any of the factors that are happening around us, because every day is going to be a new day, and when you're not stressed, you can find better solutions. So a little less stress-free life, and we'll be sorted and we'll be able to prevent PCOD. If PCOD does occur, again, the treatment for PCOD when detected early are just starting back all these things which I told you. That is, go back to exercise, start eating the right foods, drink a lot of water. Medications form only, I can say, a 30% part of the treatment. The rest is only lifestyle change.
So few of my friends, as in you were talking about lifestyle change. So few of my friends, they have restriction for dairy products and red meat as well.
Right.
So why does that happen? Why is that compulsory? As in what effect that, does it have on our body? Yeah, on the hormones as well.
Right. See, dairy products, I'll get back to that. Red meat actually is beneficial because red meat is the only source of vitamin B12 that is there. So red meat is actually beneficial because those who are vegetarians and who do not eat red meat have very low levels of vitamin B12. So in proportion, having red meat is not bad at all. Of course, having too much of red meat because it has a high fat content. So obviously it adds to your digestive problems and also increases the body fat. Regarding dairy, our ancestors and our parents had also, all of them had dairy, and they never had PCOD issues. But the problem now is because we are more worried about adulteration, about steroid injections given to the dairy, which is why, people are now going more onto vegan diet, if you've heard about it. The reason why is there is a lot of adulteration in the milk that we actually get from the cows or from the buffaloes. They've been giving steroids to them in order to increase their milk production. But what is not noticed is that milk content or the composition of that milk also changes, and to some extent that may be responsible for the increased incidence of PCOD because we are consuming milk, right? We're consuming the milk that comes from that dairy. So we don't completely restrict the use of dairy, but at the same time, we don't want to have as much dairy as we were having, as our forefathers were having. Like, they'll have three glasses of milk in the day. In fact, they used to say that बच्चे लोग को दिन में 2 बार दूध full glass पिलाना ही चाहिए. But the problem now is that now when what dietitians have found that kids who are taking a lot of dairy end up having a lot of a lot of female hormones start coming up at a much earlier age. So their breast development is happening much earlier than it should happen. Their the pubertal hair growth and all that development, their overall body development is happening much earlier. So in fact, doctors and pediatricians are advising not to give too much of dairy, because that can have the other side effect because of the adulterants that are now happening with the milk that we are getting. So that's the reason why there is a restriction in intake of dairy, but it is not that you should absolutely not have dairy. It has to be a restricted intake of dairy, meaning that maybe 1 glass of milk per day, but that's it. You don't have to completely taking, that milk se protein milta hai, so that is why keep on having milk and milk and milk and dairy products. That's not the way to go. You'll have to find other sources of proteins. If it is vegetarian, then you have sprouts, you have cereals, which are sources of protein. Okay, you have nuts, which have a little bit of protein. And if you're non-vegetarian, then there are plenty of options. For example, egg is the best source of protein. But other than that, chicken, fish, so lean meats have very good sources of protein.
So you literally lay down a diet plan for people.
Diet chart.
Diet chart for people. That's really great. And Leanne, listening to this, might be delighted with this. Yeah. So
you don't like milk.
No, I actually like milk, which is why it's so hard to hear this.
I know, but then you can have other sources of milk. So have you tried almond milk or soya milk? So that those are also very good substitutes. Of course, you need to develop the taste for it, which takes a little while. But I'm not telling you to completely go off dairies. That's what I'm trying to tell you. So dairy is not an absolute no, but not too much of it.
Not too much of it, yeah.
And few other questions as well, which is precaution related.
Yeah.
When should a woman ideally visit a gynec or get normal checkup? A routine checkup regarding this. What are the whole routine thing which, and what are the symptoms that develops when you start having having PCOD doubts? Like,
right.
What are the symptoms that you develop?
Right. So let me first correct your first sentence that women usually never visit a gynae. They routinely avoid visiting a gynae unless and until
Yeah.
they're in trouble. So
Yeah,
that's
that's why I corrected myself in the first only. I'm not the qualified one to talk
So
about
in
this.
India,
I'm like,
on an average, women never visit a gynec unless there's a problem. So there is
yeah.
no scope or there is very little knowledge of preventive health actually compared to just illness. We don't give so much importance to preventive health. By preventive health, what I mean is like going to a regular checkup and getting some tests done and making sure that I'm physically okay, but am I biochemically and internally also fine? So that preventive health checkup and a knowledge or awareness of it is very less, which has to be increased. So if you ask me that on a regular basis, ideally, a girl obviously goes to her pediatrician when she is small. So almost up to the age of 14 to 15, the girl or the boy are taken care of by the pediatrician because they go for regular visits to them. They get their booster vaccinations done and all that. Uh, but yes, the first visit ideally that a girl should have to a gynaec should be around the time of adolescence, meaning once she's just got her menses, in the first 2 to 3 months while her menses start, because she's going to have a lot of questions. Number one. Second is there can be menstrual irregularities. So you want to know, or ideally the girl should know whether these menstrual irregularities are normal or are they signs of something which is coming up to be abnormal. Okay. But if everything is going fine and she's had a smooth menstrual cycle starting and 2 to 3 years have gone fine. But after that, so ideally a girl starting her menstrual cycle at whatever age, be it 9 or 12 or 11, 13, and the initial phase has been normal and then she started having menstrual irregularities, then she should definitely, irregularities meaning not getting menses for 2 to 3 months or getting very scanty menses or getting very delayed cycles, not getting menses for 2 3 months and then bleeding continuously for more than 15 days, are abnormal. The other is getting too much of sudden weight gain, as I said, or sudden weight loss, affecting concentration and starting getting blowouts and hirsutism and excess hair growth over the face. So that is one time where they should go and check up whether this is normal, whether it is just because of my diet or some kind of another medication that I have been started on, whether I'm developing some kind of a thyroid disorder, which is why, I'm suddenly started gaining weight, or whether there is some kind of an ovarian mass or like an ovarian tumor or a cyst, which is producing some hormone, which is giving rise to all these problems in me. So this is something that a girl should come in first. Even if there are no menstrual problems, ideally she should be visiting either her pediatrician or her gynecologist between the age of 9 to 15 years, because this is the ideal age to give the cervical cancer vaccine. So ideally we have availability of a vaccine which is only available for cervical cancer. So there is no other cancer in our entire cancer spectrum which has a vaccine for it except cervical cancer vaccine. So cervical cancer is the second largest or the second most common Indian cancer in women. But very few people are aware about that, because what comes to the forefront is only breast cancer or uterine cancer. But cervix is the mouth of the uterus. It is part of the body, part of the uterus in the lower portion, which is called the mouth of the uterus. And its cancer is a totally different entity. So cervical cancer vaccine is best taken before a girl becomes sexually active. So that is why the best age to actually give them this vaccine is before they get exposed to any sort of sexually transmitted virus, especially the human papilloma virus, which is known to cause cervical cancer. So HPV vaccine is best given between 9 to 15 years, because if they take this vaccine in this age group, they require only 2 doses of the vaccine, because their immune systems are so fast and they develop antibodies so fast. After 15 years of age, if the girl still wants to take the vaccine, she can do so till the age of 43 also, but then they will require 3 doses, because now the immune system has become much slower. They produce less antibodies, so they require more shots to actually get good antibody levels. And at the same time, may not be fully effective if they've already become sexually active before they've actually had the vaccine. So that is the first and the second visit. The third visit would ideally be, before family planning, before getting married. So like a pre-marital counseling, would be a good time to visit a gynecologist to know whether you and your partner are compatible. The reason by compatibility, I don't mean mental compatibility, but by biochemical compatibility, meaning that if you are not aware, but you may be having some medical conditions such as PCOD or some kind of reduced ovarian reserve, which requires you to try and plan your pregnancy quickly after marriage, or the male partner having some other problems which can be discussed preconceptually, certain thalassemias or sickle cell anemias, which if the partners are not detected and they both are suffering from thalassemia, they could transfer thalassemia major to their unborn child. So this compatibility is something that should be seen prior to marriage. So preconceptional counseling, premarital counseling is very important, okay, to check for these things, for hemoglobin abnormalities like thalassemia, sickle cell anemia. The girl or the boy, that is the male partner or the female partner, may not have any symptoms, but they may just be carriers of the gene. And unless and until you check it, by the test, by biochemical test, you won't even know whether you're a carrier or not, because you're otherwise not having any symptoms. Right? So, but if you don't have symptoms and you come to know after marriage that when you get pregnant and that is the time when the test is done, then you both are in a soup. You're in a very difficult situation to decide whether you should continue a pregnancy, whether you should not, whether what to do next. So that's why premarital counseling. Second is fourth is a preconceptional counseling. So preconceptional is you've been married, you've been fine. If you have any infections or any complaints in the genital area, then please visit a gynecologist. And also to help you plan what is the mode of contraception that you should use. If you're not planning on a pregnancy, what is the mode of safe contraceptive, either pre-marriage or post-marriage? What are the options that are available to you? So these the girls should be aware of, so that then they can take an informed decision and decide which is the best that will suit their lifestyle and their comfort zone, right? And thereafter, once marriage is over, children are over, a woman should be visiting a gynecologist once every 3 to 5 years for doing this simple cervical cancer screening test called a pap smear screening test, which is just a clinic-based test. So it doesn't require any major blood tests or major admissions or anything like that. It's just a clinic appointment.
Okay.
Yeah.
Yeah, you answered each and every part of the question. That's really great.
Thank you.
So yeah, coming back to the topic of PCOD. So is there any other disorders which are similar to PCOD which a woman should be aware about?
Right. So just as I had accidentally mentioned in my last answer, that one of the other disorder that girls should be made aware of is thyroid disorders. So just like polycystic ovary disease is a problem of the ovary and the functioning of the ovary and menstrual cycle, a part of the menstrual cycles also get affected by thyroid disorders, being hypothyroidism or hyperthyroidism. Either ways of the spectrum, they do affect the menstrual cycle. And they also affect the weight and concentration. Now, thyroid hormone is also stimulated by what is called as a thyroid stimulating hormone, again secreted by the pituitary gland only. So that's why thyroid disorders have also increased. Hyperthyroidism is rare. It's only in about 0.2% to 0.3% of the population. But hypothyroid is as common as 10%. And common, and it's a very easily treatable condition where the thyroid hormones are haywire, but they need to be put in place so that the body metabolism remains in place, because the thyroid gland, which is in the neck, is an endocrine gland which produces thyroid hormone, and thyroid hormone controls our entire body's basal metabolic rate, so the way or the pace in which the whole body functions basically. So thyroid disorders are very common. The other common disorders is prolactin disorders, called either it could be hyperprolactinemia, secreting hormone basically, where women start having galacturia or milk discharge from their breasts without the normal physiological times, such as post delivery or during pregnancy. They are getting it at random times, and that is something which again affects their menstrual cycle. It affects their sleep pattern, it affects their weight pattern. So, and last but not the least, very commonly nowadays, not as rare as was in about 10 years back, is diabetes. So early onset diabetes is also very commonly seen. So these are some of the disorders that apart from PCOD require attention and early detection. I would just like to add one small line, is that I myself had PCOD. So I diagnosed myself to have PCOD because I had only irregular periods, never had missed periods, never had weight gain, but I did have a lot of acne issues, which most pubertal girls have. And I had delayed cycles. And after reaching a particular age, maybe once I got into medical profession, I realized that yes, I can diagnose myself. So I diagnosed, I mean, we came to know that I had PCOD. But I was not overweight either, but I realized that maybe I'm not as fit, or I'm not being physically as fit, because I was, as a child, I was quite fit and I used to be in sports in school, not as much, but I was very much interested in dance, and Bharatnatyam was one of my modes of exercise and otherwise. But I realized that, of course, yes, after our 8th and 9th and 10th standard, as we go into higher grades of education, our exercises really takes a toll. So I could manage to get back and just do a little bit of brisk walking or physical exercise just for about half an hour to 1 hour a day. And I um, uh, got my first child 5 years after marriage. So there was no family planning involved in this, but it was just a very natural conception just when we decided to. Maybe I was lucky, but what I'm trying to say and put a point here is that every PCOD is not, that it is not does not require treatment, it does not require medication, it just requires awareness of self and wanting to be just fit. So if you are fit mentally and physically, then you can overcome it. PCOD is not a big deal, it is only a lifestyle disorder, so it requires majority of the times just a lifestyle change, and everything can be smooth sailing thereon.